Animal surgery is a complex and meticulous process because it requires a level of precision, caution, knowledge, and a lot of responsibility. Because at the end of the day, a life is in our hands. This is why you should choose New Vision Veterinary Hospital for your pet's surgeries and surgical problems. Joining me is Dr. Jean Bosco, who's going to be explaining to us why New Vision Veterinary Hospital is the #1 vet hospital in this country, what do they offer best, and why it is the best spot for surgery for your pet. Greetings, Dr. Jean Bosco. So doctor, talk to us. Why should pet owners come here to New Vision Veterinary Hospital? Why is it the best vet hospital in the country, especially for surgery?
Let me start by why New Vision Veterinary Hospital is the best clinic in terms of surgeries in the country. We are the best clinic in the country because of our team. Our clinic has experienced vet surgeons who got trainings in developed countries in Europe, where the veterinary medicine is at advanced level, and they are trained by international experts in surgeries. And they are confident in what they are doing. They have experience and the skills which helps them to, or which helps us to work and to avoid post-operative complications. And advanced equipments and instruments or surgical instruments which helps us to do a successful surgery and to avoid these post-operative complications, and as well as to work away from risks. There is no zero risk, but our clinic, our team or our surgeons, they try our best to minimize the risks at the minimum level possible. Secondly, we have one of our uniqueness in surgeries. It's our anesthesiologist team who are well trained and they have experience in different anesthesia protocols. And this is one of the main aspects in having a successful surgery. They are experienced in different protocols because each surgery, depending on the situation, it has different protocol. And they are used because it's all about doing what you are used with. They are used in different those protocols and also have different drugs depending on the age of the animal and also the severity of the condition which requires surgeries. And secondly, they have advanced equipments as well, and they are experienced, they use to those equipments. We use gas anesthesia machine, which helps us for the maintenance of anesthesia during surgeries. And depending on the duration of the surgery, we also have gas anesthesia monitoring machine. And this is a main important one because it's helped the team to assess the vital parameters during surgery. And it can show you and tell you when there is something going wrong, and you can know it earlier before it brings a problem or it's life-threatening to the patient under anesthesia. And the team is trained and skilled on which intervention to be done immediately when there is an alarm from the machine. Lastly, for the anesthesia team, they are well trained in first aid, as I said, and also the recovery. So during surgery and the post-operative management, they know all of this until the patient is back to the normal condition. And this is among the protocols or among the key points to have a successful surgery and to avoid the risks during surgery or during the recovery because of anesthesia. Lastly, I would say our working environment. We have a big room and a good one with conducive working environment, and then a complementarity, we work each other as a team so that we aim to the success.
So Dr. Jean Bosco, you talked about different teams, the anesthesiology and then the surgery team or surgeons. How do they all work together to bring one good outcome?
Yes, I talked about the different teams in the surgery, the anesthesiologist team and the surgeon team. So they have to work together in a complementary way so that the surgery becomes successful. There's no way the anesthesia team, the surgeon team can be busy in just operating and then without communicating with the anesthesiologist team. First of all, the anesthesiologist team has to set well their environment and they check if everything is in place, like all the reflexes of the patient, they are okay. And then they can let the surgeon team to start surgery. So the surgeon, they wait for the anesthesiologist to say, okay, we are ready, you can start. And while during the surgery, the surgical procedure, they still communicate. Like, is everything okay? On our side, everything is fine, and on our side, everything is fine. And if there's a problem, like on the anesthesiologist team, like the patient is reacting, or there's any reaction or any alarm on the machine, then they say, okay, no, wait, stop. We need to do the intervention. There's an emergency. So those communication, they help to have a successful surgery or procedure. It has to be a collaborative team.